Hi everyone, I want to talk to you about dementia and aggression. Dementia and aggression. The symptoms are aggression towards anybody indiscriminately. It's not that they are selective in who they attack, it could be anybody, from doctors to nurses, if care is not taken, just anyone, anytime. Paranoia, they don't believe you, they doubt you, and they suspect you. Apathy, disinhibition, irritability, sleeping disorder, anxiety, hallucinations, delusions, depression, euphoria, pacing around, getting lost, and that hallucination will lead them to group home, and that might be leading them to death. That's what they call sundowning. That is, agitation peaks in late afternoon or evening. What are the possible triggers? That is the main cause. That is what I want us to focus on here. Pain. This individual may be passing through pain, but because they cannot express themselves, so being aggressive is a way to attract attention, but unfortunately, they can't tell. Maybe they are fearful, or they've just seen a new stuff, or fearful of the environment they found themselves, or they are taking a particular medication that they are now exhibiting the side effects. That might be an ongoing infection, particularly in the elderly. There could be pneumonia or urinary tract infection that the thermometer will not pick the changes in temperature, or they've had poor sleep. And the next thing, the following morning, when you want to wake them up, maybe to clean them up or to give them medication, is to be aggressive. They might be confused or actually have delirium. They could be depressed, or there is misperception secondary to poor vision or hearing, because the perception of hearing and vision probably have changed, and they perceive you or the environment differently. The hallmark is inability to take care of themselves. How do we treat feel we have confronted with this? First thing is to rate the risk level. Then we can apply non-pharmacological interventions before thinking of medication. And that will include redirections, distraction, reassurance, making sure that there's good or enough sleeping hours, can play music, or light therapy. So the first thing is not to grab the medication and give them injection or even per oral. First thing is to rate the level. Is this serious? Is this mild? Then redirect them that what is happening is not good. Don't do it this way. No, this is what to do. You can distract them from continuing along the path that they are trolling, and reassure. But be sure how many hours of sleep has she or he gotten over the last 12 or 24 hours. Can play music and light therapy. Please, let's do all this first before grabbing the medication, but it depends on the risk level. When pharmacological intervention will be needed, then we have to schedule the analgesics. It's not too good just to give it PRN because they cannot complain. So when you have a fixed schedule, that will probably help. Then our main medications for Alzheimer like memantine and donepezil could be combined. If you check my presentation on treatment of dementia, you will get a clearer explanation. Citalopram, trazodone, quetiapine, anticonvulsant, or melatonin will all be used depending on the situation, so you are free to select any of these. When you are using quetiapine, it has to be low dosage, please. You have to avoid benzodiazepine and antihistamines. Okay, in acute cases, we are going to use antipsychotics at low doses, and preferably the second generation antipsychotics. For example, quetiapine, that is Seroquel, risperidone, or olanzapine at low dosage. If there is pseudopobar affect, we're going to treat with dextromethorphan combined with quinidine. You can physically restrain, but please follow the protocol at the center and let your supervisors be aware. Methylphenidate, if you suspect apathy, methylphenidate will help. If you are suspecting depression, then choose selective serotonin reuptake inhibitor. If there is sexual inappropriateness, that should be treated with duration and antidepressant. But I will not forget to mention that the caregivers should be given psychotherapy as well, because they are fellow human beings and they could become tired and give up on this. And if that should happen, then who is going to do the job? So we have to take care of the healthcare providers as well. In conclusion, it may be overwhelming. Yes, it may be overwhelming. Everyone needs encouragement. The patient, the family members of the patient, and I will not forget to say the caregivers themselves. Everyone needs encouragement. So, as the team leader in the establishment, let's just carry everybody along. Thanks for listening to my presentation. Though aggression and dementia is a serious issue, but when we approach the situation like this or even more, then we're likely going to get a good outcome. Kindly subscribe to my channel and you'll be getting my publications immediately. Thank you.